we're excited to be here, and we'll move through our slides fairly quickly because we're really just the warm-up act for the featured speakers here, presenters here today, who are really the true innovators, or some of the true innovators in the market today, and we're excited to be all together to be able to share that innovation with you. In terms of setting the stage, there are multiple signposts for change out there, and obviously with great change comes great risk, but also great opportunity. And over the near term, we see consumer dissatisfaction with the healthcare status quo continue to grow as consumers become more accessible and more accountable and more aware. They will increasingly be frustrated by the status quo. At the same time, they're not going to sit back and tolerate that status quo, and they're going to exercise their consumer strength and their consumer power like they do in other consumer industries today. And as a result of that, you're going to see really a bounty of solutions that are going to emerge and that are already emerging into the marketplace, as it says here on point 3, that's enabled by a wave of technology and retail-based innovation that's occurring across the marketplace today. And so from that, you'll see a real shift in the B2C market and shifting societal norms, going from help me when I'm sick, or is there a pill for that, to changing the lens to more of everyday wellness and prevention. And of course, along with all this change, incumbents are really seeing and getting a wake-up call with this competitive race to own the consumer, with lots of non-traditional players coming in from all different parts of the value chain and from outside, like Walmart, making big bets and driving shifts in the existing business. So think about a couple of different scenarios just to play it through in the future. What if Walmart finally enters and captures a real significant share and portion of primary care? What if Geico or Progressive started selling health insurance? What if Amazon creates a consumer health portal that offers insurance plus consumer tech offerings? All of these are possible, and of course multiple others, and these are real scenarios to think about and consider. So as we go through here, think about those scenarios and think about you as a player in the marketplace today and what keeps you up at night. We believe that the Healthcare 2.0 marketplace, what we call the Healthcare 2.0 marketplace, will be driven by two macro innovations here. One is patient-centered population health, characterized by a new generation of players that refine care delivery and patient experience around total value, which will lead to the creation of new population segment-based care models and entire ecosystems. And we're already seeing this emerge and in practice, especially at the top end of the pyramid, so to speak. And redistributions, you're going to see lots of redistribution of revenues and profits amongst incumbents and new players in this new healthy community ecosystem. And then the second major innovation, macro innovation, is around consumer-powered health. And that's what the focus more or less will be on today. And that's again characterized by consumers who really are taking it empowered and accountable for themselves, and as they shop for themselves, their expectations rise. They seek out new and different health and wellness products and services in that new lens that help them think about, that are intuitive, transparent, convenient, technology-enabled, and it leads to changes in all aspects of the consumer experience in terms of how they think about, access, engage in, and experience healthcare, or better said, the new wellness market 2.0. So if we think about what are some of the possibilities here in terms of moving the needle, and these are some big numbers here across the next decade, but we think these numbers are possible, and we think over the next 10 years, and we think the value is going to go to those who are patient-centered and consumer-oriented. Just by 2017, for example, if you think about the value aspect of it, we believe over 100 million consumers are going to be choosing value-based health solutions by 2017, and that's really just the tipping point of where the market can go up until 2025. And then we talked about, I mentioned briefly the pyramid, and you see the top of the pyramid, the classic 5% of the patients equals 45-50% of the cost, the polychronics, the frail elders, oncology. And this top of the pyramid has seen a lot of attention and a lot of focus with some success. That's where the big dollars are. That's where the biggest gaps are to close. But it's the middle of the pyramid and towards the bottom of the pyramid where that's the next wave of innovation that is and will be occurring. And that's where these ecosystems and this new market is really going to impact. And that's where being consumer-centric is really going to be essential in understanding and engaging and touching the consumer and getting them to engage in the system. And that's where you'll see our innovators today, plus the other innovators out in the marketplace, are really focusing their attentions next. So to characterize where we are today versus where we're heading tomorrow, thinking from a healthcare 1.0 to healthcare 2.0, this is kind of the characteristics, if you will, from being a solo sport to being an ecosystem-based, from being B2B to being B2B2C or B2C directly, from being a sick care or reactive system to being preventative and thinking about total health and wellness, to being just clinical to both clinical, behavior, and social, physical to physical spaces to receive and access care to virtual anytime, anywhere, real time, to a one-size-fits-all to personalized, being a transparent, and by utilizing the crowd and your peers to understand and access. So companies going forward are going to have to do much more than just focus on the clinical dimension of a person and understanding where those benefits and funding sources go to be reimbursed and paid for. Instead, they have to focus on addressing the whole range of potential individuals for a consumer, the holistic view of a consumer, and think about how each one of those issues is interrelated and how they work together and how it can have an impact on others and an impact on your business and driving that change, getting to better outcomes at lower costs. So it's everything to thinking about mental health, to thinking about their own ambitions, their culture, how they think about money and where that goes to the family status, you name it. The other expectation of consumers is around this notion of an increasing consumer engagement is personal, anywhere, anytime, 24/7 convenience. And we'll see those that are successful in the future are going to go from just these physical sick care locations to being anywhere, anytime, where it's always available, where it's convenient, completely personalized, crowdsourced, community-based, smartphone-enabled, simple and intuitive, and situation adaptive. And this is not pie-in-the-sky prognosticating. This is really happening today for different segments and different pockets. And when it gets achieves significant scale and that ecosystem bounds are tightened, you're going to see true acceleration of the trend. So who's going to emerge? Who's going to win? Who are the players out there in the marketplace that are going to succeed? It's going to be completely redrawn as a consumer-centric space. There's going to be new market structures out there, new ecosystems, and a real new generation of business designs, a new generation of players from the outside who are going to own and dominate that consumer space and consumer access, and where there's $1 trillion in value that's up for value, that's going to rotate around in the system. So as you think about succeeding in the future marketplace, it's really important to think about, do you have the consumer in focus? And really think about the consumer in focus. And how do you own or drive that consumer relationship and experience? And how do you build credibility with that consumer? So in today's world, you think about a specific condition and the value chain piece that you play in and the reimbursement structure. In tomorrow's world, it takes a village. It's going to be much more holistic in terms of thinking about the whole consumer, and it's going to be a much more collaborative consumer value chain network ecosystem to be able to solve for it, because no one can do it on their own. And then the second key question is, are we moving fast enough? Are we moving where the puck is going? And so is the cost of inaction on the rise? Yes, it is. Is there an inflection point where we can't catch up to the leaders of the pack? Yes, there is. And then how do we react if one of these places enters in markets? And what is the partnerships that we are going to require? And where is it that our role is going to be on the value chain? And how do we differentiate and how do we add value to these partnerships, all with the goal of winning and owning the consumer and the value in the future marketplace?